the way we've set up Cosmabella, both the name and the ambiance here is of a European modern office. I don't want you feeling like you just saw a doctor. I'd rather you leave and saying, God, he felt like part of the family. I felt like very open to talk to him about all my apprehensions of the surgery, and it was very comfortable to ask questions with him. I start off a little differently than other plastic surgeons. I really start off with just getting to know what they're about. Obviously I get their age and their medical history, but I get to understand, like, if they've had kids, if they're married, what do they do for their job, because all those things can play a huge impact on the patient's end result being satisfactory to them. I pick out my patients carefully. I don't want to operate on everybody, and I certainly don't try to operate on everybody. I want to make sure they're actually doing these, they're considering surgery for the right reasons. They come in with these misconceptions sometimes that it's going to correct a marriage or you know, make themselves feel better and get a better job. And I make sure that they realize it's just a surgery and it'll make them feel better about themselves. I try to shy away from patients who want immediate results and don't want to do their part, because I can be the best surgeon and I can be as talented as I am and yet have horrible results if the patient doesn't follow through with exercise, adequate nutrition, and just being ready for an operation or a recovery phase. The common problems that I see are a woman who wants their lower abdominal pooch corrected, followed by their breasts enhanced or lifted. I like to really go back to the traditional way of maybe doing one surgery on a patient at a time rather than doing 5 different things on a patient, because the more you do on a patient, the less exact each area can be. I like to do the tummy tuck first, because usually my tummy tucks end up losing some weight, and after their weight reduction, they're super happy about that. And their breasts shrink, so whatever work you would have done at the time of the tummy tuck, you would have to redo anyways now, because now the breasts have shrunk about half a cup size or a cup size. So it's better just to stepwise it and do it, and to basically stagger the procedures a little bit. Anybody can do their surgery and get good results, but can they get excellent results and get the artistry of making something look as truly natural as it can and still really, really have improvements, not just minor improvements?